Hello, I am happy to share with you today on the ITI World Symposium Online 2021, my topic of graftless or graftless solutions. So when we look at the ridge augmentation primary objectives, we look at function, aesthetics, and prognosis. Function is to create a vital bone that will accommodate a dental implant in the ideal restorative and functional position. And the aesthetics give associated soft tissues the bony support needed for an aesthetic appearance of the gingival mucosa and facial structures. And the prognosis is to create sufficient bone volume coronally to ensure a tight soft tissue seal and a predictable long-term prognosis of the implant. If we look at the literature about bone grafting or bone augmentation techniques, vertical and horizontal, there is a lot of papers that talk about different techniques and different outcomes. I'm going to highlight just 4 of those, including the ITI third consensus statements. The techniques are guided bone regeneration, onlay or inlay block grafts, ridge split techniques, distraction osteogenesis, and recently the use of scaffolds and biomimetics. We will look at all these techniques for vertical augmentation of posterior mandible, posterior maxilla, and horizontal augmentation of the anterior mandible and maxilla. The consensus statements from the ITI, they concluded in 2009 that it's difficult to demonstrate that one procedure is better than the other. It is difficult to demonstrate that bone augmentation actually increases longevity of the implant. Each procedure has advantages and disadvantages, and the key for us clinicians is to give priority to the simplest and less invasive procedure that involves the smaller risk as possible. And they're all technique sensitive, meaning they're directly related to the experience and to the choice of materials that we make. Continuing the ITI Consensus Conference in 2009, published that bone augmentation should be prosthetically driven, or meaning in order to place an implant in the correct 3D position. So prosthetically guided bone augmentation.